It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
Our next guest, Ali Shoos, physical therapist and owner of Peak Sports and Spine Physical Therapy, who's going to be talking about Alzheimer's, and there's therapy for that too, isn't there?
Activity, exercise, nutrition, a lot of research being done in those areas, and we just kind of recognized Brain Awareness Month in June, so we want to talk about Alzheimer's with Ali. She's great. She's a lot of knowledge.
All right, here's our conversation with Ali Shoos.
Ali, welcome to Health Talk. Good to see you again, and welcome back. We're going to talk about Alzheimer's from a physical therapy standpoint, exercise, diet, etc. We just wrapped up June, which was Brain Awareness Month and Alzheimer's and Dementia Awareness Month. Hey, you have some experience, personal experience with Alzheimer's, so let's start there and kind of catch up. Your mother, right?
Right. So thanks for having me, Shannon. I love to be here. I love talking about brain health, and Alzheimer's is near and dear to my heart. My mom was diagnosed about 8 years ago. She's a feisty 85-year-old, as sassy as ever. And is in a memory care unit now. And a very good friend of mine was diagnosed with early onset Alzheimer's when she was 52. And I have a huge family, and so I have aunts and uncles and cousins with Alzheimer's, and so I have learned a lot about it since then.
You know, recently I had Dr. Doug Backus on. He's an ENT, he's a neurologist, and he specializes in hearing and hearing loss and cochlear implants. And one of the things that he mentioned that I thought was really interesting is they're finding hearing loss is an epidemic in the United States, and there's an early study out that might indicate lack of hearing or loss of hearing early on might lead to dementia and Alzheimer's. But also we know exercise and diet. You've been intimately involved in this with your mom. What have you learned from a physical therapy standpoint, musculoskeletal, diet, and how can we get involved?
Well, there is no cure for Alzheimer's, and there's very little treatment. There's a few drugs you can take early on that supposedly help slow it down, but not a lot. The one thing that has been studied over and over and over and really does show a correlation with reducing the onset of Alzheimer's is exercise, and probably has a lot to do with cardiovascular heart health, because many of the same risk factors for heart disease are the risk factors for Alzheimer's, and we know that you reduce heart disease by exercise. So helping people understand that they need to be active really early on to prevent their brain from deteriorating. So it's not that exercise is just good for your body, or people who think, well, I'm a little overweight, it's okay, I can live this way. Do you want to live without your brain? Most of us don't. So it's a really good reason, besides losing weight, being more fit. You want to save your brain. So exercise is critical.
When you say exercise, I'm sure you just said cardiovascular exercise, so it's exercise that it gets your heart rate up. It's walking, it's activity exercise.
It's activity, and there's, again, the evidence is interesting. It doesn't say this is exactly what you need to do. These are the studies, so the evidence is still out, but it does appear that it should be cardiovascular exercise, although weightlifting is great for you too. Mix it up a little bit. Right. The recommendation is 150 minutes of cardiovascular exercise a week, but it also can be mix it up. Do 15 minutes of high intensity exercise, jump up and down, climb some stairs, go for a walk during your lunch hour, but keep moving. For people who don't exercise or haven't ever exercised, think about why. If it's because your knee hurts or my low back hurts and I don't want to get out of my chair, that's really where a physical therapist comes in.
To our listeners, maybe some early symptoms. How did you notice, or what did you notice with your mom, and what should family members maybe start to be aware of? And, because there's certain things that they're subtle, and sometimes it's just like people are going, "Oh, that's just mom," or everybody's getting old and she's aging or he's aging. But there's subtle symptoms that you can pick up as family members.
There are, and actually, there's a term for it now, Shannon. It's called subjective cognitive impairment. It is where a person is aware that they have memory changes, but they're not really noticeable to other people yet. But to you, they're different than other people, your peers. They're different than your peers. So it's where you do start forgetting things. You forget dates. You forget appointments, and don't really remember them maybe until they've passed. So you start having these mild forgetful moments, but it's not just walking into a room and why did I come in here? It's really forgetting events or things. That's kind of the early stuff, being more confused about even directions. All of a sudden you're going somewhere you always go, and you're not sure if you should turn left or right, but you always drive this way. That's an early sign.
More with physical therapist Ali Shoos coming up next on Como.
It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
We continue our discussion on Alzheimer's with Ali Shoos and Shannon O'Kelly.
Ali, again, thank you for taking time to join us on Health Talk, and thank you for your passion and your concern as a physical therapist. Both of us being physical therapists, we see this quite often, and sometimes we're the people that pick it up with family members as patients come in for care. And one of the things that I'm really concerned about, and I know you are too, is kind of soft skills. Technology has driven us into computers and electronic documentation and just electronic things, but we can't forget the soft skills, which is listening and empathy. Talk to us about how important it is for family members, caregivers to listen to what the patient's saying.
Listening is critical. In fact, if we did nothing else, when I see a patient, if I did nothing else in that initial evaluation but listen to them, we would get so much further with our patients. When they tell their stories, they tell you things that you're not going to be able to test. So they'll talk to you about their difficulties with exercise or their difficulties remembering exercises. I had a patient, I will never forget her, really early on in my career, that could not remember how to do an exercise I taught her within the same session. I kept teaching her the same 4 exercises over and over and over, and I didn't pick up. That was cognitive impairment. She was screaming at me that she had cognitive impairment, and I know that now. That will never happen again. So when our patients struggle with remembering their exercises, think about why. And if you have someone who has some of that mild cognitive impairment, we have to recognize they maybe can't do their exercises at home without a caregiver coming in and doing it with them, without finding community resources where they can go to the local Y or they can go somewhere to do their exercises. How am I going to help this person be active if they can't completely do it on their own? And I'm not going to know that if I don't listen to their story. Do they have a person in their home who can take them somewhere or who can engage with them? Or a husband who likes to ballroom dance? Then there's a ballroom dance class for people with Alzheimer's. Let's connect them to that. That's how we can help.
You know, it's funny you say dance. I just read something the other day, an article that talks about dancing and movement and how it's good for brain health. I mean, again, exercise. I mean, if you like to dance, if you like to walk, and talk about activities, tell us about some resources out there. I mean, off the air, we talked about walks all summer long. Alzheimer's, we've got to find a cure for this. This is going to be economically a challenge for us to take care of these folks as we age in America here.
Devastating. I mean, in 2019, $290 billion is the expected expenditure, and it's supposed to go to $1.1 trillion by 2050. 14 million people will be diagnosed with Alzheimer's in 2050 if it doesn't change between now and then. Right now, 5.8 million are living with it. And it was 5.3 million when I talked to you about this 2 years ago on the show.
Right.
Yeah,
I mean, that's
so
those
half a million more.
Staggering.
It's staggering. So the resources, getting back to that, because I am passionate about this. There is a resource that is phenomenal. Seattle Parks and Recreation. It's called Activity with Dementia or Dementia-Related Activities. They have a calendar called Momentia that has something to do every single day all around the Puget Sound. Zoo walks, garden walks, Fry Museum visits. It's fantastic.
So there's activities, there's support groups, because I can imagine, I've seen documentaries where spouses end up taking care of. It's hard. It really is. So reach out to people, talk to people, and look for resources because they're out there.
And don't forget the ALS Association, the best resource there is.
Absolutely. Ali, thank you so much for your time. Thank you for coming down again.
You're welcome.
Ali Shoos, physical therapist, owner of Peak Sports and Spine Physical Therapy. More information on Alzheimer's, and as you mentioned, activity is a big key for treating it.
Well, there's a lot of research going on with exercise, nutrition, and more recently, even hearing loss, early hearing loss. So a lot of good stuff going on. We got to find a cure for this disease.
We'll be back with one more segment after this time out on Como.